Lack of mental health care is one of the biggest public health crises of our time, and unfortunately is impacting overwhelmingly our precious children and young adults. At any given time, 1 in 5 of our kids is suffering from a diagnosable mental health disorder. In fact, mental illness is now one of the most common childhood diseases, and we have no vaccine. Half of us will experience a mental illness in our lifetime. 50% of the time that will happen before we turn 14, before we even leave middle school. 75% of the time that will happen before we turn 24. Right in that sweet spot when we're transitioning from being a kid to becoming an adult. Most parents would rather cut off their own hand and let their child suffer. And yet millions of our kids are suffering alone because they and we lack information we need. As a result, only a third of them are getting treatment. Many of those who remain untreated will suffer profound consequences to their lives. They will fail or drop out of school. They become addicted or involved in the juvenile justice system. They will flounder and fighting their way as adults. But we have answers for these problems. We can address this through early intervention. We can provide access to mental health care beginning in our grade schools. We teach our kids, their parents, their teachers, and other staff working in schools how to recognize when a child is sick and how to get them help. We will let children language, then be identified, and then be taken care of. We want our kids to have all the information and support they can get in order to be healthy and reach their potential in life. In order to give them this, we're going to have to get around big barriers. The first is lack of access. Today, a quarter of us have no mental health care providers in our health insurance network, and 56% of counties in the United States have no licensed mental health care providers at all. Now, what do you think it accounts of this lack of resources? I think it's our second big barrier, stigma. We are prisoners of stigma that developed 1,000 years ago, long before modern science established indisputably that mental illness is the result of a complex interaction between genetics, the environment, and brain functioning. We are still influenced by fear and ignorance that caused to treat mentally ill in horrendous ways, like drilling holes in their skulls to let demons escape, and bloodletting to rebalance bodily humors, and locking them away in asylums to keep us safe from them. But this is 21st century. We've decoded the human genome. We have brain imaging technology, yet stigma prevails, and parents are some of the worst propagators of continuing that stigma. Parents gossip about other parents sick kids. They ascribe character flaws to kids who are sick, including their own. Then tell the child not to play with another child because he or she gets moody. And parents keep secrets. When their own child is sick, they will refuse services at school and tell the child not to tell anyone about his or her diagnosis. That's no one's business. Now there's a real catch-22 for a child. So if Sarah suffers depression and her mother says she can't see the counselor at school or tell her friends or teachers that she's suffering, Sarah's mom is stigmatizing depression, and Sarah will self-stigmatize. This is common, likely worsening her depression. But stigma is just ignorance. And we can overcome lack of that access and stigma. We can do this using early intervention. We can teach mental health literacy in our grade schools.